Good morning, all. Good morning. Let me first say that the last 6, 7 months have been very challenging for me. I returned from Paris, I think, in October of last year. Came down with a foot infection, and the recommendation was to amputate my left foot. I fought against the vascular division of the hospital and worked with the infectious disease department that suggested, no, we'll just do treatment for it. So we did treatment. I said, I'm a young boy, still a little boy. I don't want to be incapacitated with one leg or one foot. But their whole perception is, if you get cut off the foot, you get rid of the problem forever. I was in a hospital for close to a month, and upon my post-op, I was recommended to refer to other podiatrists. And they suggested, the podiatrist said, they wasted your time. You don't need to be amputated. We just need to remove some bones from your metatarsals that don't respond to antibiotics. And so this particular Chinese doctor did that for me, had me in the hyperbaric chamber for 7 weeks until the foot was healed. And so I am walking.
Wow. Wow.
Congratulations.
In the process, I got shingles. I don't know of myself ever having chicken pox, but apparently I had the typhus for it at some point in my life, but I never had any symptoms. It affected my sight. So I was hospitalized again in March. While I was in the hospital, I got an email when I could see out of one eye from Magnus about being a keynote speaker. I'm like, am I going to be okay to go to this thing? But I said yes. And so eventually I got a TIA, which comes with the shingles sometimes and affects my eye. But I got to tell you, without this patch, I'm seeing much better. The sight is improving. The only thing is the lid is not fully opening yet because the third cranial nerve is still a little bit, compromised. So once that is corrected, I'll be able to see well. I can see out of it if I pry it open. But if they have any surgery on it now, I might see double. I already see double without it anyway. So with that being said, we're to read the abstract that I created for the magazine. It covered unique skin concerns. It covered also cultural significance and advancements in research and technology. And it also covers the conclusions of how we should handle the diversity in dermatology and cosmetology. Which one is the button now? Which one? Up, page down, right? Well, that's mine. That's mine.
Oh, that's yours.
This is one he was using.
No, this one is the one that's yours.
Oh, look, I have one in my hand. Sorry. There we go. Very good. Okay, great. So this way. Okay.
Should I keep that over there?
No, I'm going to use this for me. There we go. So let's talk a little bit about the global perspective of skin and health, focusing on the rich diversity of dermatology across the different cultures, regions, and ethnic groups. And I'm specifically saying ethnic groups because based on the research that has been done in every area, is always on one group. And I will tell you as I go along what I mean by that. Our goal is to understand how biological, cultural, and regional factors influence skin conditions and treatments worldwide. So, skin health is an integral part of the overall well-being, affecting physical comfort and psychological confidence. Dermatology aims to address these concerns, but often lacks cultural and racial inclusivity. Recognizing and understanding diversity is crucial to delivering effective and equitable care. Today, we will examine differences in skin biology, cultural perceptions, challenges, and innovative solutions around the world. So skin biology varies remarkably across the globe. Melanin pigmentation that protects against UV rays, which is why closer to the equator tends to have darker skin. Genetics play a role in skin thickness, elasticity, susceptibility to certain conditions. Environmental factors like pollution or climate impact skin health and disease prevalence. Recognizing these variations is key to effective diagnosis and treatment. This is a map here showing, based on where you are on the equator, what happens with skin health. And so you have the native Central American peoples, you have the Aboriginal Australians, you have the Central Indian peoples, and so on and so forth. Skin tones. Now it's funny, it starts here with level 2 all the way to level 6 or 7 in skin tones based on what part of the world or your ethnicity. This would be the Fitzpatrick scale that we use a lot when measuring how our treatment system responds to certain skin conditions. Melanin plays a great role, the melanocytes play a great role in terms of the skin condition, and so on. Melanin levels from light to dark skin tones. Genetic factors significantly influence skin resilience, healing capacity. Genes dictate the production of structured proteins like collagen and elastin, which are crucial to skin elasticity and strength. Variations in these genes can make some individuals more prone to conditions like stretch marks and slow wound healing. Additionally, genes play a role in skin type, sensitivity, and response to environmental factors like sun exposure, ultimately impacting how skin heals, how skin ages and heals. Now, people who don't believe in climate change and so forth, they are a little bit off the rockers, because the way the world works now, all of the carbon monoxide we put in the air can affect, how skin performs or behaves in certain geographical regions. Some countries are more contributing, first world countries are more contributing factors to skin conditions, and the smaller countries like SIDS, small island developing states, tend to bear the brunt of it because they don't pollute the air as much, but they get a lot of the consequences of skin conditions based on what's happening in the region. So there are many factors to consider. Environmental factors, like I discussed, exposure to whether it's sun or different types of temperatures, that climates in different regions. This is the skin patches, Fitzpatrick skin type regional. So you have a type 1 here, not necessarily the best picture of her, but, and as you see, it goes down and it tells you what happens. Now, these normally go by, I would say, the homogeneous functions approach to the skin. So if you are Celtic, Nordic, Latin Mediterranean, Asian, or African, the skin is different based on either your low melanin or fair melanin level. Ethnic and cultural differences. Certain skin conditions are more prevalent differently and based on the ethnicity. For instance, keloids can be more common in individuals of African ancestry. Melasma, characterized as brown patches, often affects women of Asian or Latin American origin. Additionally, cultural perceptions of beauty influence how conditions are viewed, and some cultures have long-standing traditional skincare practices like rice mask in Asia and camel milk in Africa. So these, and then you have vitiligo, which, you know, vitiligo is a skin condition we'll talk about a little more. That affects, it's seen more in people of darker skin types. Okay. Keloids, if you don't know what keloids are, this is what keloids look like. More common in black or darker skin. May occur after a severe acne, ear piercing, and if you see people walking with extra ear, those are then keloids that have to be removed. Any type of skin injury, such as a cut or puncture wound, their size may and shape may vary depending on the part of the body that they appear. You can have them from, even when you have a port put in your chest from chemo or from cancer, when you remove that, it creates a keloid that sometimes happens. So you have different types of skin conditions. Treatment options include surgical removal, and a array of non-surgical options include corticosteroid injections and cryotherapy. Sometimes doctors recommend a combination of both based on so that it doesn't return. Melasma, if you say it's a skin condition, causes brown patches on the face, often on the cheeks, nose, forehead, above the upper lip. It's a type of hyperpigmentation, meaning the skin is darker than usual. Melasma is more common in women, especially during pregnancy, and often triggered by hormonal changes and sun exposure. Vitiligo. So if you notice, vitiligo is a chronic condition. It's an autoimmune disease where the immune system attacks the melanocytes in the body structure, integumentary system, and it affects the color. So, but if you notice, if you're darker, it shows more. We have an example of Michael Jackson, if you know who he is, who he was. He had the condition. Many people didn't believe it, but he actually did. And he did other things to even out the skin. He's a famous person, so he doesn't want to walk around with vitiligo. But but if you're lighter skin, so the people with lighter skin who will have vitiligo, but you don't notice as much because of the high skin tone. Treatments for keloids include steroid injections, silicone gel sheets, and so forth. So you have the steroid injections, you have silicone gel sheets, you have silicone dressings, and then you have cryotherapy. So there are quite a few therapies that are recommended by dermatologists or dermatological surgeons for the reformation of the skin. Laser therapy also can be used to flatten the keloids and help them fade. Surgery, surgical removal of keloids can be an option, but reoccurrence is common when you do the surgery, where it's often combined with other treatments like radiation therapy and steroid injections, like the corticosteroid we spoke about earlier. Radiation therapy, low-level X-ray radiation alone, and after surgical removal can help shrink and minimize keloid tissue. Other therapies are bleomycin injections, imiquimod creams, and pressure therapy may also be used, but the effectiveness vary. And the effectiveness vary based on the type of keloid, the size of keloid, and the pigmentation of the skin. Then you have melasma have topical creams like hydroquinone, retinoids, corticosteroid, also used to lighten the melasma and reduce hyperpigmentation. Laser treatments, resurfacing, laser resurfacing, laser genesis can help improve melasma by targeting pigment. Chemical peels, also professional chemical peels, can help to exfoliate the skin and reduce hyperpigmentation associated with melasma. Other treatments, tranexamic acid, along with medications can also be used depending on severity of melasma and other patient illnesses. So the challenges. Despite the diversity, most dermatology research historically focuses on lighter skin, leading to gaps in knowledge about conditions present in darker skin. This can cause misdiagnosis. I think we had a discussion about that last night. Delay treatment and effective interventions. Additionally, language barriers and cultural differences can hinder effective communication and engagement Accessibility remains a significant issue globally, especially in underserved populations. If you notice, when I asked the doctor earlier about research or treatment for people, he said he had no stats because he was not exposed to that. So that tells you that it's still a long way to go for us to understand global skin health, not just one group of people. And I'm using the word ethnicity as opposed to race because a lot of times we tend to confuse race with ethnicity. I think, for me, I think there are only two races, black and white. You can say brown, but the ethnicities, this determines what cultural or geographical background. So I tend to, and then now you have the homogenizing, if that's the right word, of all of these homogeneous groups. You have, or maybe pasteurizing it together, where you're finding more heterogenes, where you have an Indian getting, marrying a Chinese, or a black marrying a white, or so you have all these mixtures. So nobody's really a genuine, authentic skin type anymore. You may have two different levels of skin in your DNA, and your phenotype, you can't change that really. So that's a whole other story, which we won't talk about in much detail. Doctor will tell us over. So research, predominantly on lighter skin, and that's what happens. I find when they do a lot of these researches, even when I'm getting data from other groups of companies, they only have one group of people that they do research on. It's always lighter skin people. And they don't go into areas of darker skin types. I'll just say that for them to get collect data. And all the research is not as and I think one of the reasons why they don't do it is because financially they don't think that some of those groups can be targeted to a certain price point to make money from. So that can play a role, which we'll talk about a little later. Then you have different things that can cause keloids. So you have, well, blackheads are not that bad, but when you have cystic or pustules or those things, or even scars here, you can get keloids from, maybe overexerting the skin. And a lot of people who have a lot of these conditions tend to want to pop them themselves. It's a natural thing. You have a pimple in your face, you want to pop it. As a child, I used to do it a lot. So and you do it for a while, depending on the sensitivity of your skin, you can create something that looks like a keloid. Advances and innovation. Recent advancement include developing skincare products that are targeted to hyperpigmentation scarring prevalent in darker skin, using AI tools capable of analyzing diverse skin tones for accurate diagnoses, and increasing participation of diverse populations and clinical trials. Culturally sensitive education for healthcare providers improves patient outcomes. So when you have, and that's why we have to sometimes, I try to indicate when I do any sort of guidance counseling in schools, is to have people choose professions relative to their community that you plan to live in. And I'm saying that to say that when you are a dermatologist and you study where your research from your studies is only geared towards one group, when you leave school and have to do your own practice, and you're only familiar with one group of people, it's difficult for you to diagnose sufficiently or correctly or effectively someone of a darker pigmentation that you have no background or training in. So if we were to encourage more children, young people in different ethnicities, to go into dermatology to help their community, it's easy for them, they understand their own skin more. And that's why we need more research. And so new formulations for hyperpigmentation scarring, AI, and digital imaging for all skin types, inclusive clinical research, education tailored to cultural competence. So diverse skincare products, disparities. There are racial and economic disparities in personal skincare products use and exposure to potentially harmful chemicals. Black women, middle-aged adults, and lower-income consumers are more likely to use products with higher hazard scores. So these disparities are influenced by beauty standards, marketing practices, and the presence of harmful ingredients in products marketed to specific groups. Elaboration: racial and economic disparity. Studies have shown that Black women, and to some extent Hispanic and Asian women, are more likely to use products containing more harmful chemicals. This is partly due to societal pressures to conform to Eurocentric beauty standards, which can lead to the use of products that claim to lighten skin or straighten hair. Can't leave out the straightening of the hair part. So the beauty industry often promotes products that align with Eurocentric beauty ideals, leading to overuse of certain products among women of color. This can result in increased exposure to harmful chemicals, such as phthalates, parabens, whether it's methyl or propylparaben, and heavy metals. Black women, product selection and exposure. Black women, for example, are known to use hair relaxers, straighteners more frequently, which contain more harmful chemicals like endocrine disruptors. Additionally, women of color are more likely to use skin lightness creams, some of which contain toxic substances such as mercury. So health disparities. These disparities in product use can contribute to health inequalities, particularly among Black women who may experience high levels of endocrine disruption and reproductive health problems. So we have to do something called beauty justice. The term beauty justice highlights the need for more regulation and consumer awareness regarding the safety and personal care products, especially those marketed to marginalized communities. So the need for research. More research is needed to better understand the impact of beauty products used on different racial ethnic groups and to develop strategies to reduce exposure to harmful chemicals. So here we have AI. There's now creating these dashboards in apps where you can, put your skin on the screen and tell you what outcome you would have based on the treatments that you are required to use. So AI is kind of leading the way. Hopefully we'll be able to bring it down to brick and mortar and to actual processes that can help the consumer. So different regions face unique skin health challenges to show genetics, environmental, and culture. For example, in Africa, hyperpigmentation and keloids are common concerns, often addressed through traditional remedies and modern care. In Asia, melasma, like we said earlier, is highly prevalent. Influencing cosmetic approaches, and Latin America emphasizes sun protection, while Europe, aging skin receives focus. So a lot more research is done in Europe as opposed to those other parts of the world. What companies are doing, instead of having research in areas in like Latin America or Africa, they're just having manufacturing plants as opposed to the research labs, usually labs of somewhere else, And so the clinical trials that they use are only based on quantitative data. We said all this already. So the future direction, the global perspective on skin health is shifting towards more holistic, personalized, and sustainable approach with a focus on skin longevity and addressing specific skin concerns. We kind of touched briefly last night in our roundtable discussion at the dinner table about anti-aging products and some skin whitening too. And some of these products that are used for anti-aging, they reach a plateau where after a while they don't work. All the fixes are temporary, and they're not enough research done, as we discussed, to know what long-term effects or how these products will affect the consumer over a period of time. The studies are very short. I think sometimes about 6 months, I believe. I don't think they do 18 months or even 2-3 years. And so what I noticed too is that once this product doesn't work anymore for this client or consumer, he or she, mostly she, just goes to another brand, hoping that will start the process again. Advances of crow's feet still comes, sagging, bags under the eyes, knocking skin, all that stuff still happens after using this product. Works for you aesthetically, doesn't change anything internally. And you look great for a couple of days, and you have to go back to the same product 10-15 times to look great. So future directions include incorporating AI for personalized treatments, such as expanding dermocosmetics using biotech-based ingredients. Additionally, there's a growth emphasis on clean beauty, inclusive beauty, and sustainable practices within the beauty industry. And you can see we included some males here. So you can see some males are into skin health as well, not as much as obviously the female gender. So here's a more detailed look at the key trends. Personalized skincare, AI and data-driven approaches are being used to create customized skincare routines and treatments based on individual skin types, concerns, and environmental factors. Skin longevity. The focus is shifting from solely anti-aging to broader concepts of skin health and longevity, with an emphasis on maintaining skin's natural resilience and functionality. Dermocosmetics. Dermocosmetics, which combines skincare and cosmetic treatments, are gaining popularity as consumers seek more effective and science-backed or science-based solutions for specific skin concerns. You're doing well. Biotech-based ingredients. Formulations incorporating derived from biotechnology, offering a potential and enhanced efficacy and safety. Clean beauty. Consumers are increasingly prioritizing skin and natural ingredients, leading to a surge in demand for sustainable and eco-friendly skincare products. Inclusive beauty. Brands are focusing on inclusivity, catering to diverse skin tones, skin types, and sensitivities, and focus on creating products that are accessible and effective for all. And the reason why this is important here is because companies like, for example, L'Oreal, who I worked for 17 years, they spend lots of money on research. And they try to do it in a cross section of groups so that they can get more accurate data. I don't think enough companies are doing it enough. One of the things companies that some of them are trying to do is trying to meet the global prognostication of by the year 2030 or the year 2040, the minority will be the majority. So you're going to have all of these interracial, interconnected group become the population of this world, right? And so companies are trying to stay ahead of the game by doing some research to get products that are inclusive for all types. They haven't perfected it yet, because some of the products still need more research, but they're working on it. And I think having boards or having groups like this can help to encourage these companies to do more research for the wider community, not just for me, for you, but for everybody included. Yeah. Almost done. Oh, wrong one. Sustainability. There's a growing awareness of environmental impact on the skincare industry, leading to more sustainable packaging, ingredient sourcing, and production practices. Holistic approach, the integration of skincare with whole body wellness, including diet, lifestyle, which we didn't talk about, health, is gaining traction in consumer as consumers seek to address skin health and more comprehensive perspective. Now, with skin health as well, if you're treating a patient or a client or a consumer on a particular therapy, and he or she has a lifestyle that's not congruent with the research you're doing, you're going to get adverse effects. You're not going to get any impactful results. So you may have to encourage the patient. That's why doing a good client consultation or patient consultation and analysis to decide what the client's lifestyle is like, what the environment is like, so that you can know if you're going to treat this patient or client or consumer, whichever you want to call them, you're doing targeted treatments. Because if they have cirrhosis of the liver, I'm just saying, or they have some other immunocompromised condition, or they live in an area where there is lots of dust or carbon monoxide or whatever, sometimes the treatment you do may not be effective. So you have to know where they are and have treatments geared towards that targeted group. So technology, technological advancements also needed. Skin microbiome. Research on skin microbiome is expanding with potential for developing new therapies and personalized skincare products based on individual microbial ecosystems. So that's the idea for me. I think we did our time.